Hey, hey, how's everybody doing? Dr. Malaika Woods here, medical doctor and healthy lifestyle strategist at Dr. Woods Wellness and founder of this group, The Natural Hormone Fix. I hope you guys are having an amazing day. Again, I'm the founder of this group, the Natural Hormone Fix community. Here in this group, we believe that the body is divinely designed and has a great capacity to heal. And so, if you believe that, then you are in the right place. We also believe in one of the most natural things you can do for the body, as far as giving it back what it's missing, is actually bioidentical hormone replacement therapy. So, we talk a lot about that in a lot of our episodes. But today, on today's live stream, we're actually talking about functional medicine. And actually, one of the subtitles of this group, it's functional medicine for the divinely designed woman. We talk a lot about hormones, but I want to talk about functional medicine in particular today. So again, like I said, I'm the founder of this group. We believe that the body is divinely designed and has a great capacity to heal. I have been helping women and men achieve optimal health, tap into that divine design for the last 13 years, and I'm on a mission to help more people do the same thing. Medical disclaimer here, everything that I'm sharing is for educational purposes only. It's not to be your personal medical advice. Certainly, you need to speak with your own physician or practitioner about any treatments and what would be best for you. So, today's topic is functional medicine. Is it right for you? I want to dive into this because I think people may have different understandings or maybe just not even familiar with the term functional medicine. We are talking about functional medicine. Is it right for you? I want to talk about what does it mean exactly? What are the different ways that I've helped people with the functional medicine approach? Perhaps what types of medical issues would be appropriate for functional medicine? I'll dive into all of that today. Super excited to be sharing with you all today. I also want you guys to be on the lookout because we're going to do another giveaway contest. So I like to do these periodically. And it's summertime. I think it's a great time to meet more of the people in the group. I also want to thank you, all of you that are watching. I know sometimes you're not always commenting, but I can see that you're watching. I want to thank you for that. We actually have just got over the landmark of 4,500 members in the group, 4,500 members in the group. Let's give a thumbs up or a heart for that. This is a thriving community, and we want it to continue to grow. Hey, Karen, thanks for joining us live today. So, the innovative approach to healthcare is what functional medicine is, and it focuses on the root cause approach. And one of the best analogies that I can give is just imagining a picture of an iceberg. And sometimes I do share that when I give my talk. So, imagine an iceberg and you've got the water level, you see the tip of that iceberg above the surface, and then you can imagine there's a lot of that iceberg underneath the surface. And so when I think about functional medicine versus traditional medicine, I think about traditional medicine being above the surface. And in traditional medicine, you're often asking the question, what? You have to have a diagnosis, right? Before they can really do anything. And so I'd love to hear from you guys today. Do you have particular health questions? Again, I'm going to be answering questions at the end today. But before we get there, are you dealing with a particular health issue that you're wondering, is this something appropriate to be addressed via functional medicine? If you have that question, type in the chat, like, what is that health issue? So when I think about hormone replacement, I think about the functional medicine approach really to everything we do. Just a few weeks ago, I talked about the functional medicine approach to GLP-1. So we do it in a certain way. But in general, functional medicine is about that root cause approach. So, again, if we take that analogy of the iceberg and we think about traditional medicine as above the surface, and we think about functional medicine as below the surface, traditional medicine is often asking the question, what? And it's just the idea that, and this is just really the constraints of the traditional medical world, your doctor really can't do a lot for you until they have a diagnosis. So some of you have had the frustration where you have symptoms, you don't feel well. You may have even some labs that are considered abnormal, but you don't meet the criteria to be given a diagnosis. And oftentimes, unfortunately, your symptoms may be ignored a bit, or you may be told it can't be the thing that we thought it was because you don't technically fit into the realm of what that lab should be. So I understand that can be quite frustrating. And so the difference with functional medicine is that we're actually not super concerned about your diagnosis. We're not super concerned about your diagnosis. We're just trying to understand what is the root cause of your issue. And I'm going to talk about gut health here in a moment. And I think that's a great analogy to this because oftentimes, as far as your gut is concerned, someone may be given a diagnosis of, say, like irritable bowel disease. How many people, and that may not be something you want to raise your hand to, but have you heard of irritable bowel disease where there's one type where there's a lot of loose stool diarrhea, IBS-D. There's another type where there's more constipation. But basically, this is a diagnosis that's just a descriptor. Someone has a lot of bowel issues and they call it irritable bowel, and then they give you some medication to treat the symptoms, but they never understood what the root cause was. And so if we look at it from the functional medicine standpoint, if I see someone who, say, has irritable bowel, I want to know what's going on in their gut. I don't want to just give them a medication to treat the symptom. Are you guys following me so far? Give me a thumbs up or a heart. So, what I said initially is that traditional medicine asks the question, what is the thing? What do we call it? Whereas functional medicine is asking why. Traditional says what. So, type what in the chat. For those of you who are with me, type what in the chat. What in the chat? What is what traditional medicine asks? That's their main question. And then functional medicine, type Y in the chat, WHY. Why in the chat? We want to know why. I am in a lot of different groups, and some of them have physicians in them. And a lot of you guys who I call the true health seekers, the wellness warriors, the divinely designed women, you guys are starting to ask these questions. And they're getting a little frustrated because they don't have answers for you. And I'm not saying I have all the answers, but I do have some things that I want to look into when we're asking the question why. And some of you are starting to ask why. Yes, what, why? Hey, Julie. Hey, Kimberly Cole Davis. Good to see you joining us today. Hey, Crystal Germain. Thanks for joining us today. So that's one of the differences, asking the question what versus asking the question why and digging a little bit deeper. And I told you that I will share some stories along the way as well. So let's take the gut health and the irritable bowel, for example. So I had a patient, her name is Joan, and she's actually been on and talked publicly. But I had seen her in the past, she came back to me and she was having gut issues to the point where she was having multiple bowel movements in a day, where she said she had to plan her days around her bowel movements. Her and her husband liked to hunt. She couldn't really do the things that she wanted to do because she had such issues with her gut. And in the traditional world, it's usually just really a matter of, okay, if you've got diarrhea, I'll give you this. If you got constipation, I'll give you that. Without, again, asking the question, why do you have constipation? And why do you have diarrhea? So that's the difference in functional medicine. So we did some specialty testing with her, looked at her gut. And when I say specialty testing, and that's another important piece of functional medicine, is that we do like to do specialty testing to understand what's going on in different areas of the body. But in this case, what we found is like overgrowth of certain bacteria. And so we did some natural herbal remedies to treat some of those things were overgrown in her gut. And she got her gut health back in order, where she could go out and not have to plan her day and bowel movements back to normal. So that's one of the amazing transformations that I've seen just in my own practice as it relates to gut health. So that's one of the big differences between functional medicine and traditional medicine is asking the question what versus the question why. Another big difference between the two is that we have this approach, we call it a systems biology approach. And it's really the idea of recognizing how all the different systems are connected. So, in our current traditional medical system, medicine is practiced in what we would call like silos. If you think about those big silos that hold grain, so there's rheumatology and dermatology and gastroenterology and immunology and gynecology and oncology and hematology. That's a lot of ologies as it relates to medicine. And all of these people are great experts in what they do. The difference in functional medicine is we really try to recognize the interconnectedness of all of those things. And what's really cool, a lot of us wellness practices will use sort of a tree as a representation of functional medicine as well. And I want you to think about it this way. You'll see the roots often in the picture, and then you'll see the tree and the branches and the leaves. And so what's cool about functional medicine is this idea that one root cause problem, say like overgrowth of bacteria in your gut, can manifest itself in a lot of different ways. So in a negative way, that tree analogy, you've got overgrowth in your gut, you can have skin issues, you can certainly have diarrhea or constipation, you could have inflammation in the body and joint pain. So that can manifest itself in a lot of different ways. At the same time, if you were to provide some sort of intervention at the level of the root. So now we get rid of, say, that overgrowth of bacteria, or if we start reducing inflammation, that one intervention can also manifest itself in a lot of different ways. So you see improvement in the gut, improvement in the skin, reduction of inflammation. So you can see a lot of improvements by one simple intervention. Are you guys following me so far? Give me a thumbs up or a heart if you're following me so far. So those are some of the differences between functional medicine and traditional medicine. And certainly another big one is it's really patient-centered care because functional medicine, we have the opportunity to spend more time with our patients. Hey, Julie, thanks for joining us today. We have more of an opportunity to spend time with our patients. And so, like for me, I spend 90 minutes on that initial meeting. And so, you're not likely going to get that in the traditional world. And again, it's just how their system is set up. They have to see a lot of people in order to bill how they bill. And that's just the way of how it works in that particular setting. But for us, we get to spend a lot more time with our patients. How many of you have seen a functional medicine doctor or integrative medicine specialist, whether it be a physician or maybe you've seen a chiropractor that does functional medicine or a nurse practitioner? How many of you guys have seen a functional medicine specialist? Give me a thumbs up or a heart. Hey, Frida. Hey, Patty. Thanks for joining us live. Hey, Sue. Thanks for joining. Sue said, you, as in me. Yes. How many of you guys have seen a functional medicine specialist? I see some thumbs up and hearts coming through. All right, awesome. So some of you are familiar with some of these things. The other thing that we really recognize in functional medicine, so if you haven't yet, I want you to understand the approach and then you can decide if that's a right fit for you. We really believe in the individuality of each person and understanding that everybody's body can respond differently. And you guys have maybe you've taken a medication before, if you've had to take an antibiotic, or if you ever read the labels of all the side effects. Now, most people don't get side effects, right? But there's always that little percentage of people that are going to get hit maybe with those particular side effects. And so we never want to discount someone when they say that they took something and it made them feel a certain way. We always want to consider that and understand that each individual is different and people respond differently. And that is so important. Absolutely, Jermaine. That is so important that we really recognize that. And one of my things, and I think this is true across all functional medicine practices, I hope it's true, but I'm going to say for me in particular, one of the things that I really try to emphasize is just the ability to listen that goes into having longer visits because I think what's missing in the traditional world is that you as the individual, you don't have the opportunity to really tell your story. They have stats about how quickly a patient is interrupted when they come into a doctor's office. Let me ask you guys, how quickly do you think a patient is interrupted when they go into a doctor's office? How quickly? And it's not minutes, it's seconds. How quickly do you think a doctor's interrupted? I'm sorry, how quickly do you think a patient is interrupted when they're in a doctor's visit? How quickly are they interrupted? How long do they get to talk before they get interrupted? Let me see some numbers in there. Now, I told you it's less than a minute, but I shouldn't have told you that. I gave too much away. How many seconds do you think? I actually read somewhere, I think there's a little bit of a delay here, but I think I read somewhere between 7 and 15 seconds. So, Jermaine, you're pretty up on it. You're pretty right. You're pretty accurate there. That's what it is. But again, that's the world that they live in. The other thing that's different between functional medicine and traditional, and this is why I want you to understand it, is that we really believe in taking a comprehensive approach. Some of you may have had experience, because again, the name of this group is the Natural Hormone Fix. So we talk about the hormones a lot. But again, I call this functional medicine for the divinely designed woman. That's the subtitle of this group. And so I think that approach, that comprehensive approach is important because I think even some of you, okay, you guys, 20, 30 seconds, Frida said, wow, on, yeah, 7 to 15 seconds. You guys can actually look that up. But the functional medicine approach, I think, is important because I think some of you have even had hormone replacement therapy and you may have felt that wasn't the end all be all because it's not for everybody, though it is a huge key, I feel, in optimizing your health, but it's not the whole story. And so with functional medicine, one of the big areas of emphasis is taking a comprehensive approach. And so we really believe that the way you tap into your body's divine design is by taking a comprehensive approach. So you can't address hormones and not address your nutrition, or you can't address nutrition and not address your sleep. And the other thing that I think is really big that I talk a lot about is that your mental, your spiritual, and your emotional well being is an important part of your healing journey. How many of you guys believe that? Give me a thumbs up or a heart here in the chat if you believe and you know to be true that your mental, spiritual, and emotional well being, those are an important part of your healing journey. Absolutely. And they've done studies to show that people who have high blood pressure, if they do certain exercises to reduce their stress, they can actually reduce their blood pressure. They've shown studies of individuals who have cancer, and if they pray or if they meditate, they have shown better outcomes. So it's pretty amazing how, and they say that we probably, what do we use? Maybe 10% of our brain's capacity. Like we don't even know the extent of what the body can do. And there, we talk about mind-body connection. Talk about brain gut connection, hormone. There's all these connections that we talk about, but we don't want to forget about the spiritual and the emotional because that plays a role as well. Jermaine says, OMG, amen. Yes. Sue says, oh, yes. Frida says, definitely. Okay, you guys are agreeing with me that those aspects are important. And a lot of times doctors aren't addressing that. Give me a sec. But those are really important aspects. We don't want to forget it. Jermaine says, I'm a real life witness to that being a breast cancer survivor, thriver. Yes, that's awesome. And just having the right attitude. Now, the treatments, of course, make a difference, but also having the right attitude as you go through something plays a role as well. So thank you for sharing that for sure. So, what are some of the other pieces as it relates to the difference between functional medicine and traditional medicine, or what makes functional medicine stand apart? So, if you guys don't live in the area, so you know that I'm located in Missouri, and I work with people like Missouri, Kansas, California, but we also have people from all over in our group. They're not just from local. And so, if you're looking for a functional medicine provider, you can go to the Institute for Functional Medicine .org or ifm.org, and there's a listing of certified physicians and practitioners all across the country. So, functional medicine is about getting to the root cause. And I love functional medicine. It's about a holistic approach, it's about being personalized. I mentioned that. One of the things that's been really cool to do is to either help people get off of a medication or help people prevent having to get on a medication. And one of the things that I've seen over and over again, thanks, Jermaine, for putting that in there, ifm.org, you got it. One of the things that I've seen, just for an example, is working with people on their cholesterol. So, again, when we work with people, we don't just look at hormones. Again, I do a lot with hormones, but that's not the whole story. Okay. So, we look at your cholesterol, your blood sugar, all of that. And I see a lot of people with rising cholesterol levels. And some of that actually may be due to some hormonal decline. Also, just as our metabolism and other things change as we mature, as I like to say. But I have seen, guys, some amazing results with getting cholesterol numbers down. I'm talking about 20, 30 points with just natural interventions, no statins. And the thing with statins, I'm not a huge fan. I'll just say that right now. Some people have the basic side effects of like muscle aches, but they've also shown that statins tend to raise blood sugar levels. And so for people who have been on statins for a while, the risk of developing diabetes actually goes up. And I've seen some studies that show that statins even have an association with breast cancer. So I know some people have to take it, but if you don't, and if we can find a natural approach, then that's definitely what we want to do. And so I've seen cholesterol numbers come down quite amazingly using the holistic approach, using supplements and things like that. Yeah, absolutely. I've seen blood sugar come down with different approaches as well. And so, one of the other really amazing things that I've seen just with hormones is a couple things I want to talk about. One is how many are having aches and pains right now? Anybody having aches and pains in the body? Give me a thumbs up or a heart. I talk to a lot of women and men who are dealing with like aches and pains in the body out of nowhere, as it seems. And so, one of the really profound things that I witnessed in a patient a few years ago is that once we got her thyroid optimized, she told me that her body aches had gone away, which I was even amazed by that. I had to go back and check that out. But something like thyroid, so again, recognizing that all of these systems are interconnected. Usually, when you think about thyroid, what do you think about? When I say thyroid, what are you guys thinking about? What are you thinking about that the thyroid does for the body? What are we normally talking about when we talk about the benefits of optimizing your thyroid hormone or what the thyroid hormone does? What are we typically thinking about? What you guys got there? Got a little bit of a delay. So, thyroid is usually you're thinking about energy. You may be thinking about metabolism, so helping with weight loss. Those are usually the two things that people think about as it relates to thyroid. But the thing that thyroid also, or to note, is that almost every cell type in your body has a receptor and a need for thyroid. And so the thyroid hormone, that's interesting, guys. You said can regulates the other hormones. Okay. Sleep, hair, body temperature for sure. So the other thing that the thyroid does, because there's a receptor and a need for it, like everywhere, almost everywhere, it can impact how your muscles feel because they need thyroid. And so that was pretty interesting in that particular patient. Something else I learned about thyroid, again, just thinking about how all these areas are interconnected and why it's so important to really look at everything and not just one thing. They've shown studies that people who are dealing with depression and mood issues, if you compare getting the thyroid optimized versus, say, an antidepressant, you can elevate the mood just by getting the thyroid optimized. I think that's pretty amazing. And then if we talk about other natural interventions, studies have also shown that regular exercise can improve the mood about as good as an antidepressant. So think about that as well. So we're talking about a comprehensive approach to things and understanding how one hormone, we think of it in a particular way, but it actually can help the body in a lot of different ways. And so that's super important as relates as well. Now, I've been talking a lot. We got about 4 or 5 minutes left. If you guys have any questions, type those in the chat. If you have any questions, type those in the chat. I wanted to really address those main things. Again, functional medicine is about getting to the root cause. Functional medicine is about asking why versus asking what. Functional medicine is more personalized. You get more time with your physician. Functional medicine also recognizes the idea that the body, all these systems really work together, and we try to address those, acknowledging that. And so with functional medicine, we use holistic approaches, we use supplements and things like that. But I also caution people because when I meet folks, a lot of times they're suffering from what I call PTSD, right? Post-traumatic supplement disorder. Because so many of you, again, I call y'all the wellness warriors. I call you all the true health seekers because you're out there looking to get better. That's why you joined this group, because you wanted to learn more about natural hormone approaches, about functional medicine. And you're buying a lot of supplements. You're buying a lot of supplements without maybe having a specific plan of action. And we do use supplements in functional medicine, but we try to use it strategically. And so oftentimes we're taking people off of supplements because they're on too many. But I do want to say this too, you want to make sure you're on good quality. And so if you're getting your supplements from the local grocery store, from Walgreens, Walmart, CVS, just stop it right away. Just slap those out of your hand. Okay? There was an expose of supplements that came out a few years back where they looked at, I'm going to say these names. I don't know if I'm going to get banned, but Walgreens, Walmart, and CVS, because they all use the same parent company. And they looked at those supplements and found that there was talcum powder, spruce tree powder, all the stuff that wasn't supposed to be in there or didn't need to be in there was in the supplement. And I know a lot of times, so the point is you got to get good quality supplements. Okay. You need more like pharmaceutical grade is what we call it, where they're third party tested and things like that you can get from a physician. You really can't buy those from the store. But if you're going to go to the store, don't go to those three that I named. go a step above that, like someplace where they more specialize in health type things. Maybe it's Sprouts has some good qualities. Maybe it's a nutrition shop or something like that. And then the highest level is where the doctor is able to dispense. So make sure you're getting good quality supplements. That is an important part of what we do in functional medicine, but don't get the trash supplements. Let's see here. I've got a question. What to do about vaginal dryness? My doctor suggested estrogen, but the side effects cause cancer. Okay, Patty, let me talk about that. That's really a great question. If you're giving estrogen vaginally, that's considered topical. And when you're giving it vaginally for vaginal dryness, what's called vaginitis is the technical name for that because all of that tissue down there is sensitive to estrogen. Even your bladder is also sensitive and needs estrogen. So for some women as they mature, if you're starting to urinate more frequently, having burning with urination, if you've been feeling like you have bladder infections a lot or you've been diagnosed with bladder infections without them actually drawing cultures, some of that may be due to a lack of estrogen. So when you give estrogen vaginally, you're only giving it a few times a week once you get through the maintenance. You're not raising your blood level of estrogen. And this has been well studied, Patty, even in women who've had a history of breast cancer, giving vaginal estrogen does not cause cancer. So that should be completely safe for you to do because it doesn't raise your blood levels, just putting it topically on. And that's been studied. So you can absolutely use vaginal estrogen. It's not going to increase your risk of cancer. Thank you for asking that question. All right, guys, I think my time is up. If you've enjoyed the conversation today, if you felt like you got something, a nugget or two to understand the difference between functional medicine and traditional medicine, give me a thumbs up or a heart. I want to thank you for joining. Share this with other people, tag them, have them join our group. We are 4,500 strong and continuing to grow. I want to remind you to be encouraged today. I want to encourage you in the idea that your body is divinely designed and has a great capacity to heal. We just need to understand better how to give the body what it needs. So, all the divinely designed women out there, you guys have an amazing day, and we'll see you next week.